And we're gonna have to do squats later. Hey everybody, it's Dr. Wade with Orchard Health.
And Sarah, the nurse practitioner with Orchard Health.
And we're gonna talk about Older Americans Month, which is the theme for the month of May here, and how a DPC practice can work well as we get older. I think one of the main things that sticks out to me is the time we get to spend with our patients in the office, and the fact that as we get older, we have more medical problems and more questions. So a typical 5 or 10 minute office visit is not gonna cut that to cover all those topics. What about yourself?
One big issue that I see with older Americans is polypharmacy. You know, we've had a lot of medical issues for a long time. Sometimes we're on a lot of medicines, and sometimes those medicines don't really play well together. We can have some side effects. So that's one thing that I think having more time with people in the DPC environment gives us time to go through those medications and really optimize them to the patient. Another thing is falls. You know, we're on all these medicines that can make us dizzy and, you know, just kind of really impacts and increase our risk of falls, which is already a huge issue for older Americans.
I think you're right, Sarah. I think falls fall into that prevention. And I think that's another part of the time we can take is preventative measures to help, whether that's falls at home, falls out in public, managing the medicines, and then prevention in terms of vaccines and making sure that we're on target with everything that we're doing there for our health and wellness so we can have the most in our older years of life. I think those are all really great parts of a DPC practice that fit well for our elderly population and really bring them here to get that kind of care and service. So I think here for Older Americans Month, a great way for DPC to take care of these folks and be a benefit in a different type of healthcare model.